Hello everyone. Our proposal is called Predictive Statistical Research Model for COVID-19. About the challenge is addressed to health and especially research. Something about us. We are an NGO called Asociația Lumea lui Alexandru, or in English Alexandru's World Association. And our goals are protecting the rights of patients with Hunter syndrome, with tracheotomy, disabled people and children, medical issues, social, educational, and research related to the above. Our motivation. Rare disease are already a challenge, and the new coronavirus and the disease COVID-19 is adding more pressure on the patient. The solution we created is a statistical predictive system to choose from a different range of factors which defines a certain type of reaction or severity or treatment linked to this disease. It can take into consideration demographic indicators, for example, the density of the infected people in certain areas, or medical indicators, IgG, IgM, aka antibodies, and other types of problems, diabetes, obesity, heart problems. In fact, the prototype can take into consideration a lot of factors. So the proposal is a prototype. It has few demonstrative data, but it can be added others like those mentioned above. We assume that in short time there will be a great amount of data linked with COVID-19, and a very good tool in order to get some conclusions or patterns should be a model that can be customized in the sense that the physicians or researchers choose the fields they think have higher importance. About the technical solution, we have included SQLite database, so the data is permanently stored, R and Shiny. And also neural network for implementing a prediction model, so taking into consideration some factors, a few factors to determine the profile of certain I don't know, for certain diagnosis or profile of patients. The outcome is a prediction of a risk to develop COVID-19 by taking into consideration as many factors as we want. We also assume that we have the test results, and that that way the model can be validated. The database structure is very simple, and the data are for demonstration purposes for now. So we included the general symptoms, for instance 10 of them: shortness breath, fever, dry cough, chill body aches, sudden confusion, digestive issues, pink eyes, loss of smell and taste, fatigue, headache, throat, and another indicator which we consider is very important, the IgG, aka antibodies, which have some values according to age and minimum and maximum span of values. And we included also an indicator called IgG risk, in the sense that this value is under or upper these values, and the presence of antibodies are a big high indicator of an infection. Okay, let's see how it works. So we have the data set, the fields for the data set corresponding here, the model of the data. So prediction is, for instance, please note that we have here the predictions. These are the values that the model is computing, and we assume that we have the test results. The test results already. Come on, let's see how it works. For instance, let's pick some of the factors from the general symptoms and from the IgG. So the IgG risk and hit predict. No, sorry. The database is locked. So this is the database. Okay, once again. Okay, so we pick some factors from the general symptoms. We take the IgG risk from the IgG table. We hit predict. This is the neural network that is constructing our predictor, and we have here the predictor. So we can see, for instance, for register 1 or 2, we have a prediction equal 1. This means it's highly probable that the patient has the disease or an infection, which seems to be coronavirus. For the second patient, it is confirmed, and we take a look at the factors from the we picked. So these ones are 1, so the patient has headache, fatigue, loss of smell, pink eyes, and the other one has also the majority of them. Let's see the IgG risk for the patient 1 and 2. Here is no surprise. They have no signs of infection according to IgG. For instance, 9 and 10, also one is evaluated as, well, both of them are evaluated as negative. The test results are for one negative, for other one is positive. And here are the values we picked. For the L11 record, we can see there are a lot of confirmations about the signs. And the antibodies 10 and 11 also, we don't have any surprises. Let's take a look at the 20th. So and also the IgG. Here we have a high level of the IgG risk because it is above the range, above the threshold. Okay, let's take another one, fever and short breath. We know there are very important indicators of the model, and hit predict again. you can see something has changed here. So record 1 was 1, the predicted value was 1, and we additionally picked the shortness breath fever. The second is also confirming. 10-11. Okay, let's hit some more. And we again have a bit of change here. For instance, 17. Or 10, 11. Let's see how it is on the HG side. 10, 11. And some that are negative. 13, 14, 15, 16. Let's see how it works here. 13, 14, 15, 16. They are negative. Or, for instance, the 8. The 8. 8 has a high risk of IgG because it has a lot of antibodies. It's confirmed and the prediction matches. Okay, this is it. This is our prototype. Thank you for your attention.